Hi friends, welcome back to my channel Mukambika Nursing. Friends, here we are discussing questions for ESIC Nursing Officer exam preparation, and the exam is on 7th July. Hardly 1 week is there for the exam. You can download your hall ticket from official website and follow all the instructions before going to the exam. Here we can see the questions. Hormone responsible for telarchy is options. Option A estrogen, option B progesterone, option C androgen, option D growth hormone. Our question, which hormone is responsible for telarchy? Telarchy means starting of breast bud or development of breast bud. It is one of the sign of puberty. So the hormone responsible for telarchy is estrogen. Option A is the correct answer. And the next question, the function of an adjuvant in a vaccine is to enhance. Options, option A distribution, option B absorption, option C immunogenicity, option B dilution. Question is, what is the function of adjuvant in vaccine? Okay, what it will help? It will help to improve the immunogenicity. Immunogenicity means it will help to act against foreign bodies. It will produce the immunity. Okay, so the adjuvant helps to increase the immunogenicity. Move on to the next question. Heart-lung machines are best sterilized by options. Option A 2% glutaraldehyde, option B ethylene oxide gas, option C isopropyl alcohol, option D 100% phenol. Question, which one is used for the sterilization of heart-lung machines? And the correct answer is ethylene oxide gas. Option B is the correct answer. First option 2% glutaraldehyde, which is used for the sterilization of endoscope, cystoscope and also rubber catheters. And the next question, the connection between umbilical vein and inferior vena cava in the fetal life is known as options. Option A umbilical artery, option B ductus venosus, option C ductus arteriosus, option D pulmonary artery. Okay, the question is the connection between umbilical veins and inferior vena cava during the time of fetal life. In the fetal life is known as ductus venosus. Option B is the correct answer. Okay, ductus venosus means it is the connection between umbilical veins and inferior vena cava. Move on to the next question. Use of Salter scale in community is used to measure. Option A weight, option B height, option C malnutrition, option D mid-arm circumference. Salter scale in community is used to measure weight. Option A is the correct answer. And the next question, first disease is also known as options. Option A rubella, option B measles, option G chikungunya, option D chickenpox. Which disease is also known as first disease? It is measles. Option B is the correct answer. Measles is also known as rubeola. So the first disease is measles or rubeola, and the second disease is scarlet fever, and third disease is also known as rubella, and fourth disease is also known as Duke's disease, and fifth disease is also known as erythema infantiosum, and sixth disease is known as roseola infantum. Okay, so first disease is measles or rubeola, second disease is scarlet fever, third disease is rubella, and fourth disease is Duke's disease, fifth disease is erythema infantiosum, and sixth disease is roseola infantum. It is very important point. And the next question, sixth disease is also known as options. Option A erythema infantiosum, option B rubeola, option C roseola infantum, option D scarlet fever. As we already discussed in the just previous question, so sixth disease is also known as roseola infantum. Option C is the correct answer. And the next question, which is also known as universal donor? Options, option A O negative, option B AB positive, option C O positive, option D AB positive. Which blood group is known as universal donor? It is O negative. Option A is the correct answer. And universal recipient is AB positive, and most common blood group is O positive. Okay, this is also previous year question. Universal recipient is AB positive and most commonly seen in blood group is O positive, and rarest blood group is AB negative. And the next question, cause of tetany in a newborn is? Options: option A hypocalcemia, option B hypoglycemia, option C hypokalemia, option D hypernatremia. Question is, what is the cause of tetany in case of newborn? It is due to hypocalcemia. Option A is the correct answer. Tetany, the hypocalcemia, decreased serum calcium level will lead to tetany. Here the important point is the newborn of GDM, gestational diabetes mother, is at risk for hypoglycemia, hyperbilirubinemia, hypocalcemia and respiratory distress syndrome. So the baby born with hypocalcemia is one of the cause of gestational diabetes mellitus. And the next question, just before cardiac arrest, which ECG abnormality seen in patient? Options: option A dysarrhythmia, option B irregular dysarrhythmia, option C ventricular tachycardia, option D all of this. Question is, which ECG abnormality can see just before cardiac arrest? It is ventricular tachycardia. Option C is the correct answer. And the next question, what is the temperature of cold stress? Options: option A 32 to 36 degrees Celsius, option B 36 to 36.4 degrees Celsius, and option C less than 32 degrees Celsius, and option D 36 to 38 degrees Celsius. Temperature of cold stress. Cold stress is also known as mild hypothermia. Usually this is seen in newborn babies and all. Okay, immediately their adjustment period they feel hypothermic. So the temperature is between 36 to 36.4 degrees Celsius, or in Fahrenheit 96.8 to 97.5 degree Fahrenheit. Celsius it is 36 to 36.4, or in Fahrenheit 96.8 to 97.5 degree Fahrenheit. And the temperature of moderate hypothermia is 32 to 35.9 degrees Celsius, and in severe hypothermia it is less than 32 degrees Celsius. Here cold stress or mild hypothermia is our question. It is option B. And the next question, common clinical features of intestinal obstruction is? Options: option A diarrhea, option B bilious vomiting, option C fever, option D all of this. Which is the common clinical features of intestinal obstruction? It is bilious vomiting. Option D is the correct answer. Move on to the next question. Which of the following pulse is used for the assessment of unconscious adult client during a resuscitation? Options: option A brachial pulse, option B radial pulse, option C carotid pulse, option D femoral pulse. During the time of resuscitation or CPR, which pulse is commonly used for the assessment in unconscious patient? In an unconscious patient, we are taking carotid pulse. Option C is the correct answer. And the next question, what room temperature should be maintained during the period of phototherapy? Options: option A 24 to 28 degrees Celsius, option B 25 to 30 degrees Celsius, option C 30 to 32 degrees Celsius, and option D 32 to 34 degrees Celsius. Question is, what temperature should be maintained while phototherapy or during the time of phototherapy? It is about 25 to 28 degrees Celsius. It is mainly to prevent hypothermia or to prevent hyperthermia. So the temperature will be maintained 25 to 28 degrees Celsius. In our option 24 to 28 is there. So that is the correct answer, option A. And the next question, what is the optimal distance between the neonate and light while giving phototherapy? Options: option A 25 to 30 centimeter, option B 30 to 45 centimeter, option C 40 to 50 centimeter, and option D 50 to 55 centimeter. Our question is, up to what distance we will maintain the neonate or newborn baby and the light of the phototherapy machine? It is about 30 to 45 centimeter. Option B is the correct answer. And the next question, how many times baby should pass urine during phototherapy? Options, option A 1 to 3 times per day, option B 4 to 6 times per day, option C 6 to 9 times per day, option D 9 to 12 times per day. The baby should pass urine during the time of phototherapy is 4 to 6 times per day. Option B is the correct answer. And the next question, fetal heart rate can be auscultated with a fetoscope at which week of pregnancy? Options, option A 5th week, option B 10th week, option C 20th week, option D 25th week. Our question, at which week we can auscultate the fetal heart rate by using fetoscope? It is about 20th week of gestation. Option C is the correct answer. And the next question, vector of Kala-Azar is? Options, option A housefly, option B testis fly, option C sandfly, option D mosquito. Here the question we have to see vector of Kala-Azar. Kala-Azar is one of the communicable disease which is caused by Leishmania donovani and its incubation period is 1 to 4 months. And the vector of this Kala-Azar is sandfly. Option C is the correct answer. Friends, today again we discussed questions from previous year question papers. Also I included important questions. Surely these questions and important points will helpful for your exam preparation. If it is useful for your studies, please share my videos to your friend circle.